Hi, my name is Yakira Batista. My presentation today is going to be about how to do a prophylaxis. First, we have to make sure the patient is sitting in the right position in the chair so she could have a good cleaning and she could feel comfortable. First, we're going to prep the patient. We're going to put the bib, and we have to make sure we have all the instruments so we could do a good cleaning, a good prophylaxis for the patient. Make sure we have suction. Also, we're gonna need a prophy angle and we're gonna need prophy paste. Also, we're gonna need a basic. Once we have everything ready, I'm about to start the procedure, so we have to make sure the patient is fully covered. We always have to put goggles on the patient so we can avoid any piece of the paste to go into the patient's eyes. The procedure, it always has to start by quadrants. We should start for the upper left of the patient. And like I said before, do not put too much pressure on the patient's teeth. We have to make sure we don't push too much pressure and too much speed. Why? Because the tooth can get overheated and it's gonna cause damage to the patient's teeth. Gently, we're gonna polish her teeth. Make sure we clean all the surface, always from the outside. Once we're done cleaning the outside, we have to go to the inside of the patient. Always put the suction on the patient so the patient don't open for anything. We always have to suction everything inside the patient's mouth and just keep cleaning on the inside. For patients that have fixed bridges, they always have to use different tools like Proctor brush. They also need to use floss threader. As you can see here, they're gonna need this kind of tool, always, because since they have bridges, they can get into the inside and the tooth can collect inside and it's gonna cause damage to their bridges. Prophy angles, Proctor brushes, super floss, all that is for patients that has fixed bridges. Patients that has a lot of sensitivity, we always use the floor varnish. This is for patients that has a lot of sensitivity, that they can drink or eat anything cold. This is really helpful. For patients that has a lot of bleeding, we always use irrigation. Irrigation is always with chlorhexidine. This is to avoid any infections to the patients or any bacteria inside the patient's mouth. Once we're done, we always have to make sure we rinse the patient's mouth with a lot of water so the patient doesn't get anything and the patient can feel comfortable once they're done with the cleaning. Once we're done with the cleaning, we always have to do flossing. Okay, flossing for the patient is really important. Patients supposed to floss their teeth every night after they eat. You have to show the patients how they floss, and for the last, it's going to be instructions. Okay, we're going to floss the patient's mouth, and then the patient is ready to go. This is basically what you do to do a prophylaxis. I hope you like it, and I'll see you soon.